Earlier, President Trump gave an update on Operation Warp Speed. He said by April, the entire population would have access to the vaccine, with the exception of one state. Let's take a listen.
Process is starting right away. Millions of doses will soon be going out the door. They're all ready, waiting for that final approval. As soon as April, the vaccine will be available to the entire general population, with the exception of places like New York State, where, for political reasons, the governor decided to say, and I don't think it's good politically, I think it's very bad from a health standpoint, but he wants to take his time on the vaccine. He doesn't trust where the vaccine's coming from. These are coming from the greatest companies anywhere in the world, greatest labs in the world. But he doesn't trust the fact that it's this White House, this administration. So we won't be delivering it to New York until we have authorization to do so. And that pains me to say that. This is a very successful, amazing vaccine at 90% and more. But so the Governor Cuomo, will have to let us know when he's ready for it. Otherwise, we can't be delivering it to a state that won't be giving it to its people immediately. And I know the people of New York very well. I know they want it. So the governor will let us know when he's ready. He's had some very bad editorials recently about this statement and what's happened with respect to nursing homes and his handling of nursing homes. And I hope he doesn't handle this as badly as he's handled the nursing homes. But we're ready to provide it as soon as they let us know that they'll actually use it. And again, it's a very safe and a great vaccine.
Joining us to discuss those comments and more is Dr. Tom Frieden, who served as CDC director for President Obama. Thank you so much for joining us. To start off, we heard the President Trump, say that there will not be another federal lockdown. Do you envision cities enacting their own lockdowns instead, like the one we saw in Chicago this week?
What I think we're going to see inevitably is different approaches in different parts of the country. What would be really helpful is to have a common playbook so that what's done in one state and what's assessed in one state is similar to another. But I agree that there's not a need for everyone to do the same thing at the same time. In fact, that was one of the big mistakes of this administration in the spring. There were places that locked down too soon for too long before they had COVID there. But I do think, unfortunately, the reality is hitting us. We are having the highest numbers of COVID in the entire pandemic. It's in more places with higher numbers, and they continue to go up rapidly. We are not in a good place, and we're heading into the holiday season when people travel, they gather indoors, and the possibility of more spread is unfortunately a certainty, not a possibility. But there's lots that everyone can do to reduce risks. Wear a mask, wash your hands, watch your distance, reduce risky indoor activities. Unfortunately, Thanksgiving plans have to be reconsidered. If you have lots of people coming together indoors for a long period of time, that's a formula to accelerate the spread of COVID, and that's going to result in more deaths.
Now, while we see cases rising, there's a lot of excitement surrounding the Pfizer vaccine. Do you think that excitement is justified given what's going on right now?
Well, on the one hand, it's very good news that there seems to be a high level of effectiveness. We haven't seen the actual data. We don't know how long the protection will last. We don't know if it will work for older people, and we don't know if the vaccine will be safe. But all that said, it's encouraging, because if the Pfizer vaccine works this well, it's likely that many other vaccines will also, and that over the coming months, many months, we'll be able to roll out a vaccination program. It's not a vaccine that prevents infection, it's a vaccination program. And getting that up and running is a big job. It requires doctors, nurses, pharmacists, patients, community groups, all thinking together, working together, understanding what the vaccine can do, and maintaining trust in the vaccine is crucially important. But the bad news is that even with a vaccine, there's no fairy tale ending to this pandemic. It will be with us for at least much of 2021, and therefore we need to adjust what we do, reduce risky indoor gatherings, wear a mask regularly, and participate with the health department when it comes to measures like reducing risky activities, getting tested immediately when you feel sick, don't go outside if you feel sick, and if you're a case, participate, cooperate, so you can warn people you may have exposed without meaning to.
Now, let's stay here for a moment, Doctor. We heard Dr. Anthony Fauci this week saying that there's help on the way and encouraging people to stay hopeful. While we want people to stay hopeful that this may end at some point in time in the near future, are you concerned that this kind of messaging may lead people to act more carelessly because they're anticipating a vaccine?
Yeah, unfortunately, what we've seen through this whole thing is some overly simplistic false dichotomies. Yes, a vaccine can be a great thing, but it's not here yet. And therefore, we have to keep up what we've been doing, in fact, do much better to reduce the spread of the virus. The numbers are mind-boggling. You're going to see 2,000 deaths per day in the U.S. before the end of the year. Already, it's the third leading cause of death. Really, when you count it accurately, more than 300,000 Americans have been killed by this pandemic, and the number's likely to rise by 100,000 in the coming months. So this is a terrible problem. It's not just for our older Americans, but also for people with underlying conditions. And you know, that's about 40 to 50% of all adults in the country. So it's a lot of people who are at high risk. And it's not just death. It's about the long-term disability. We're learning more about the so-called long COVID with people who are ill for weeks or months. We don't know what the future will hold, but we do know that if we act now, we can make a big difference. We can reduce the spread of COVID. We can reduce the number of cases. We can get our jobs back, get our economy back, save lives if we do some simple things and get the basics right. Stay indoors when you don't have to go out. When you're indoors with other people, wear a mask, wash your hands, increase ventilation, and rethink those holiday plans, because we saw after the 4th of July, after Memorial Day, after Labor Day, after Thanksgiving in Canada, where they have it earlier than us, big surges. And right now, we're already in a big surge. If we go further, we're talking about rates that are going to overwhelm our healthcare system. We'll see nurses and doctors getting infected, many of them dying from this. We need to protect our seniors. We need to protect our nurses and doctors. They're the heroes on the front line, and we all can play a part in protecting them and protecting ourselves.
Wow. Doctor, one more very, very brief question. What do you think is the biggest contributor to the rising cases right now?
I don't think it's one thing. I think probably three things are going on. One, winter. More indoors and the virus lasts longer in cold weather. Two, fatigue. We're all sick and tired of this virus and we want it to go away. The fact is, it's not going away anytime soon. And three, we reopened things before we had crushed the curve. There was still a lot of virus spreading. And because of that, it has come roaring back sooner in places that never crushed the curve much at all. And it's taking longer to come back in the Northeast, where a better job has been done by communities and governments keeping it at low levels.
Well, we actually have time for one more quick question. Now, you had interactions with Joe Biden during your time as CDC director. Based on those experiences, how do you envision him attacking this pandemic?
There are three things that I've found really encouraging from both what the transition has said and my experience with the then Vice President Biden. One, he's going to rely on science. And that means get us all on the same page. Let's get the facts straight. Tell them what we know when we know it, what we don't know, how we're trying to find it out. That's the first. Second, be organized. I worked closely with Ron Klain, who will be chief of staff, and I'll tell you, I sleep better knowing that Ron Klain is going to be there because he's brilliant, he's well organized, he's effective, and he gets government working well. He gets everyone working together, make sure that you get the right decisions made and then get them implemented well. So based on science, well organized, and well communicated. One of the most important
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.